Thank you very much. All right. So the whole point of us being here today, I mean, we all know that the political season is around the corner, and the whole emphasis or aim of today's discussions is to ensure that health remains at the fore of these discussions while we get into or prepare for the 2027 general elections. And so at this point, just to welcome us and really set the tone for the conversations we'll be having today, please join me in welcoming Mrs. Vivian Ihekwezu, Managing Director, Nigeria Health Watch, for the welcome remarks. A round of applause as she takes the stage, please.
Good morning once again, everybody. As Chris mentioned, we're extremely pleased to see the room so full this morning, and everybody is here on time. And for me and for us, that really is testament of how important people find the topic we're going to cover this morning. So good morning, ladies and gentlemen. Good morning, our distinguished. So over the coming months, as political aspirants start to make promises of what they will deliver, manifestos are written, priorities are negotiated, and promises are made. That gives us once again that window of opportunity now more than anything to really put health firmly on the political agenda. Because now this is the time when those political commitments are still being shaped. So the question is whether we will use this window of opportunity differently this time. And we've had several opportunities, as we all know, in previous times. We have not really seen health appear sufficiently in manifestos. Often promises that political aspirants made are quite broad, very general. You know, they may say we want to improve healthcare, we want to reduce maternal mortality, we want to expand health insurance, but really what exactly will be done? How much are they even willing to invest? How many actually put a figure behind what and how much they're willing to invest? And how will success be measured? And what happens if those commitments are not delivered? How do we as citizens hold them accountable? So really, the gap between a promise and a measurable commitment is really central to our discussions today. And as an organization, Nigeria Health Watch, we have been working at the intersection of health and politics for some time. Not that we are, we want to keep this apolitical, so we're not speaking to any political party per se, we're talking about all political aspirants. And we've gone through 2 different editions of our Vote for Health Nigeria campaign, which we will introduce and provide you with more detail in 2019, ahead of 2019 and 2023 general elections. And we really encourage citizens at that time to ask political aspirants a very important question. What is your plan for the health sector? And I recall when we were doing the Vote for Health Nigeria campaign in 2019, and we went around the country to different states and really asked people, what are your priorities in terms of what you want your political aspirants or people vying for political power to deliver? And unfortunately, of course, we know the acute challenges people face, and things like security, of course, employment are critical for anything. But we often found that health doesn't often figure as high up in what people state. And we always wonder, is it because often people do not have enough understanding or realize that they actually have that right to healthcare? And decision makers and politicians should also hold themselves accountable to deliver for their people. So in 2022, our Future of Health conference, the political economy of health, investing in the future of health, really focused on this issue. And today's session, today's conversations resonate very strongly with that conference because both from the start, we started from the premise that health outcomes depend not only on technical solutions, but on the political choices that determine what gets prioritized, what gets financed and ultimately what actually gets delivered in the end. And Dr. Gafar, I'm sure you would remember, in 2022, you were really part of that conference, and the discussions were really focused sharply on how do we make sure that we push health up the political agenda. And we're still pushing it. We're still there. And we will keep on doing it, because as civil society, as NGOs, that really is our mission. Because if we don't do it, ultimately, who will be that voice for citizens in terms of voicing and making sure that we hold our political aspirants accountable? So as we approach 2027, we need to go even further. We need to ask the questions that remain ever more important today. But we also need to record those answers and interrogate whether they are credible, and return and see what happens after the elections. So that is shifting this meeting from just raising awareness, but really moving from listening to what those political declarations are, but actually making a concerted effort to track. And there's good reason for this sense of urgency. We have a rising population. Our health outcomes, we all know the stats, are nothing to be proud of. We have over 72% of healthcare paid for out of pocket, and that is a very high figure. And given the current economic realities that most families face, that is a very high number. Households are already struggling with multiple challenges. How do they provide housing, education for their families? Transport costs are rising, and the burden of illnesses in our country is not getting any less. And we saw from the 2022 Lancet Nigeria Commission that really made the case even more powerful, because it argues that health could be a political lever, and governments that improve population health can actually gain political dividends. So how do we translate this to political aspirants to make them understand that you can reap political dividends by delivering quality and good health care for families? And the financing context is getting even harder. 2025, I think, was that rupture where the financing landscape we all assumed would continue completely changed. And that really has meant that there is a greater need for more domestic funding for our healthcare. We cannot depend on external funders to continue to fund our domestic health system. And for us to really build that ambition, we need to make sure that the decisions made in the upcoming election also influence how much healthcare is prioritized and funded. So that really is why health is a political choice, because with constrained budgets, there is not much choice in how health is funded. And we as citizens need to make sure that we hold government accountable. Because also for citizens to be educated and to be aware that they also need to consistently ask politicians, yes, about jobs, about security, about roads, but also, what are you going to do for my health? Each year as a family, we travel back to the east. I'm sure many people do the same, or go back to your hometowns. And we often see the disparities in healthcare delivery when we go home. And we often ask, yes, we may be living in the big towns in Lagos and Abuja, but really, in our own communities, how is healthcare being delivered? They are local officials who have a huge role to play in delivering healthcare, and we too should play that role in making sure that people, even within our small communities, understand the importance of knowing who is actually responsible for delivering that healthcare and quality healthcare that they need. Because, as a country, we don't often think about whether elections can be won or lost based on political choices. In some countries, for instance, in the UK or the US, what political aspirants say about health can really influence the way the election goes. For example, in the last US unity, more than anything. So thank you all. 1 million children are born in Nigeria every day. What is our responsibility, and what is the responsibility of political aspirants and decision makers in making sure that the future generations of Nigerians, both now and current, actually have access to quality healthcare? Because a sick population, really, we can never ever aspire to reap those demographic dividends that we often talk about and boast that we're such a huge population that it is an asset. It is and could be an asset, but we also need a healthy population to also have a productive and healthy economy. Thank you all very much, and look forward to further discussions.
Please, another round of applause. Thank you very much, Fabian, for that really right on the money in terms of a welcome remark. And I think it is right, or she's right, you know, public accountability is essential to holding our decision makers accountable for the commitments that they make to health, while also keeping health high on the political agenda as we prep for the 2027 election. And this will also demonstrate political dividends that these decision makers stand to gain by prioritizing health and delivering tangible improvements for citizens throughout their political journey. So these are some of the conversations we'll be having, and I'm glad that that context has been set. To further drive that point home, please join me in welcoming Mr. Solomon Oladimeji for his technical presentation.
Good morning, everyone. It's a pleasure being in your presence this morning. Also, talking about political health as a political issue. And permit me to stand on the already established protocol, as I will be giving us evidence spotlights on the health financing gap and also the political choice ahead. All right. So this morning, majorly, we'll be looking at how health as a political issue is centered around 4 interconnected spotlights. And looking at it majorly from the structural health financing in Nigeria, looking at subnational patterns as well, and also the external funding environment, how that is shrinking. And of course, we also take some context and learn some lessons from African countries, other African countries like Nigeria, and also we'll go out of the African continent as well to look at another instance from another country out of the continent. So majorly, would start from looking at the health financing crisis from a national overview. And there's a contradiction, because if we look at it, Nigeria has the largest economy by GDP in Africa, but we are still the one with the worst population health outcomes. We can see that it is contradicting, and from the 2 different ends. And majorly, when we look at these worst population health outcomes, under 5 mortality, maternal mortality, malaria prevalence, and malaria deaths, the number seems huge. And majorly, it all boils down to political will and political commitment. And this is part of the reason why we identify health as a political issue. And one of the reasons why we are gathered here today is to talk about health as a political issue. And now we can drive that home. So, and another thing majorly is that most of Nigerian families today, they are one illness away from a catastrophic financial distress. And as my MD has mentioned, over 70% of out-of-pocket expenses, that's huge. And it means that for every family, for most families, just one illness can send the family packing and they won't be financially sustainable anymore, which is also the reason why health, it's very strong as a political commitment, and we need to ensure that we hold our political leaders accountable for this. And looking at it, according to the Nigerian Lancet Commission 2021, approximately about 40% of Nigerian population lives in poverty. And out of this 40% that lives in poverty, a lot of them are still paying out of pocket for insurance, for healthcare. And majorly, the burden rests on households. So these households are the ones, are the electorate, they are the ones that vote our political leaders into power. And we need to ensure that they actually vote for health. And this is why we are setting the context for 2027, because the election is around the corner, and one of the things we need to ensure is that health outcomes are they improve, because ODA is shrinking, the burden is more on the citizen, and any of our leaders that come in 2027, they will be judged on most of these health indices. Either they know how to go about it, so we must ensure that we really vote for someone that can actually put health as a priority. And another major thing here is that the gap between the structural deficits and successive administration in previous electoral cycles is actually wide, because there's a lot that the citizens are demanding, and it's not just health, but as we know, health is a priority, which means that health is also a political issue. I would also like to talk about the financial crisis, majorly the national overview on allocation. The 2026 national budget for Nigeria, initially when it was on the reading on the floor of the House, when we look at the percentage allocated to health, it was just about 4.2% initially. But eventually, the entire budget increased, but the health budget of the component did not increase, and it now drives that 4.2% down to 3.7%, and which now makes me to take us to the Abuja Declaration in 2001. Since then, we have not had the federal government and most subnational level governments actually get to that 15%. If we have all agreed that 15% of the total budget should be allocated to health, in 2026, that's several years later down the line, why are we having 3.7%? So it's a thing of political will, which also drives the point that health is a political issue. And if we now look at it closely, the government expenditure on health is actually very, very low. Because right now, the government is spending about $12 per person per year on health. And our peers within the other African countries are spending about $55 per person on health per year. And that's not even the benchmark. The benchmark is $90. So if the benchmark is $90 according to the SDG, and currently we are spending $12, and our other countries, other African countries are spending $55, we can see that we still have a long way to go. It still drives the point that it's about political will. And I know I've talked about out of pocket. The burden is actually real, and it is real on households. So it's all about priority. And looking at it, the federal government and most of the subnational level governments are not spending enough on health. However, their fiscal envelopes is increasing. Between 2022 and 2024, there's about 80% increase, 80% growth in the state fiscal envelopes. But that is not on health. And if you look at the subnational level governments, about 5.2% average of the entire budget of the subnational level government is spent on health. It's still very low compared to the 15% agreed for the Abuja Declaration. And this drives the point that the states are not poor. The states are really not poor. They can spend more on health. But everything boils down to political will. And there is a variation here, because in some states, we are finding out that out of the 15% Abuja Declaration, most states are between 1% to 13%. And if we look at it, it's actually, the gap is wide. But we must ensure that we are able to close the gap. So, and what we also realize is that what the state budgets is not what they actually spent eventually. And so it's not even an issue of the 15% right now. The 15% is there. Most of the states averagely spend, they allocate 5.2% averagely. But even the 5.2% that is allocated, just about 61%, or let me say 62% of that 5.2% is actually spent eventually. That's expenditure. Allocation versus expenditure now. That's also very huge. Although we have some states that are that we can learn from, a state like Ekiti and Yobe, who about 2 consecutive years spends almost 98% of the entire allocation for health. But the conversation around even still spending the budget, the 15%, even still spending it on health, spending it on what is supposed to be prioritized, it's another conversation. But now, what we need to drive home is that we make health as a political issue, and we make health as a political will. I'm going to talk about Rwanda and Thailand. And both countries, when Rwanda started rebuilding when they started their health systems, rebuilding the health systems, it's the stage that started from was way worse than what we are in Nigeria. And we all know about the 1994 genocide in Rwanda. That also crushed their health system, so they had to start rebuilding. And today, they are a typical example of a country that really have a strong health system in the country, in the continent. And how did they do it? They used community-based health insurance. They are able to reduce their under-5 mortality, their maternal mortality, as well as their malaria incidence. So, and majorly part of what they did is actually accountability, so which is also very important. On the case of Thailand, Thailand is a middle-income country in 2001, and majorly the stage that Nigeria is right now, that's where Thailand also started. And right now, they have also made a lot of progress in their health system. We can learn from countries like this. Mainly, most of our political leaders see health as a charity, but health is not a charity, because for there's a lot of return in investments in health, and it's about 3:1. And also, the Lancet Nigerian Commission 2022 report also reported that about 837,639 deaths could be averted by 2030. That's if we're able to put boots to ground and ensure that health is a political will and health is a political issue. And health affects the economy, it affects productivity, it affects, it's also a political dividend. And there's a lot of risk in not doing anything, because the Lancet report that talked about 837,000 deaths being averted by 2020, it also means that if we do not do anything, in 2030, there will be 837,000 deaths if we do not do anything. That's what it also means. So we need to actually do something. And evidence shows it that for every $5 that is spent on health, there's about $45 return on investment. And how do we have this $45 return on investment? We need to fund primary health care. We need to pool risk through insurance, both the formal and informal sector as well. Then we need to pay for results, not inputs. There are a lot of very good programs that have run through the, both the federal and the state government in Nigeria. Programs like the 71 Million Lives Programs for Results, where we pay for results and not inputs. These are part of initiatives that could be employed to be able to ensure that we do this. Then, as I've mentioned earlier, the subnational government and the federal government need to be able to release what they have budgeted for health. So it's not just about allocating for health, it's also about releases for health. Without lobbying, because we know a lot of states, even after budgeting, the State Ministry of Health still needs to lobby and ensure that, okay, these allocations are released. So it now brings me home to why we are here today. How does this matter for 2027? ODA is shrinking, debt servicing continue, and also to provide more context, the reason why the budget was increased and why the 2026 budget, I'm saying, was increased and why the percentage for years shrink from 4.2 to 3.7 was because of debt servicing. So debt servicing is increasing, out-of-pocket payment is increasing. We need to be able to bring in innovations and a lot of initiatives to ensure that a lot of conversations that we have here today really matters for 2027 election. And Nigeria is not short of commitments. I mentioned the Abuja declaration earlier. We have the 4-point agenda of federal administration. And I'll end with this, that we will track reports and return by this time in the next electoral cycle, we'll be able to evaluate how this matters and how we have been able to drive political will and ensure that health is identified as a political issue. We did a full-on desk review on this, and these are some of the references to some of the resources that we'll put together to put this desk review together. And also, we'll be sharing this via email to all attendees at the end of the session. Thank you very much.
Another round of applause for maybe one thing I should have mentioned is, so that is our professor at Nigeria Health Watch. So you could see his presentation was very rich with data. So maybe I should have given you guys a heads up before then, but thank you again. Please, another round of applause for him. And he said it right. We're not short on commitments, especially to health in this country. I think
because it doesn't give you notice. It's not like, you are because it doesn't give you notice. It's not like, you are prepared and then you're able to respond. It's just, something that happens, and it is good if we're able to respond. That is why it's a political issue. That is why it needs that level of commitment. I have two esteemed panelists who will be joining me on stage to have this very important contribution, or conversation rather, and also your presence here, because like Chris mentioned, it is a group discussion, and we're going to open it up for that. I'll start by introducing Dr. Murtala Mohammed Bagana, the Honorable Commissioner for Health, all the way from Niger State, who, despite this public holiday, has actually made it a point to be with us here today. Dr. Bagana is a public health physician and a health systems expert with extensive experience in primary healthcare reform, immunization, and health program management. He previously served as the Senior Technical Advisor to the Executive Director, CEO of the National Primary Healthcare Development Agency, where he contributed to major primary healthcare programs and healthcare consulting, bringing both technical and political leadership perspective to our conversation today. Thank you so much for joining us, sir. Please have your seat. Next, I'd like to introduce, he's also my boss, Dr. Gafar Alaode. He is the CEO of DGI Consult and a public health and health systems expert with extensive experience in health financing, governance, and domestic resource mobilization. He has led major systems strengthening programs in Nigeria, including serving as the country director for Health Policy Plus and the chief of party for the USAID-funded Health Finance and Governance Project. His work has also explored the intersection of health policy, political accountability, and citizen engagement, bringing an important civil society perspective to today's conversation. Dr. Gafar is also the co-chair of the Universal Health Coverage Forum, which we belong to. And we also have, I'd like to introduce Dr. Bujima Konjola. She has just joined us. She is the chairman of that forum. And just for you to understand just how important this conversation is, we have the high and mighty from the civil society organization, and we're really grateful for your presence here. Thank you very much. Dr. Mustafa Leki, thank you very much. So these are my two esteemed panelists, and I will be joining them on stage for the conversation to begin. Thank you. Thank you so much again, Dr. Bagana and Dr. Alaode. Thank you. Dr. Bagana, I'm going to start with you. Solomon's presentation has sort of set the context. And we have seen, that, yes, there has been some movement on the part of government to make some commitment to, apart from the Abuja declaration, 15%, but we've seen that even the envelopes have increased for health in terms of the budget. But I know that, when it comes to these things, political commitment is really the main issue. But just sharing with us, from your experience as the Honorable Commissioner for Health in Niger State, and possibly, what you have also discussed with your other colleagues, what is the biggest barrier stopping us from actually making that commitment and investment in health?
Okay, thank you very much. Good morning, listeners. Good morning, everyone. Please, can you hear me? Okay, absolutely. So thank you very much. I think the last presenter just set the stage. And reflecting on his presentation, I think I probably want us to take a little step back. It is not enough to say health is a political issue. For me, framing should have been, especially for us politicians, will have been more better stated when you say health is one of the strongest political dividends. That is the language you want to hear. So coming now back to the question you asked about what are those barriers. And I like the fact that I think we're having conversation. The question is, who made the commitment? Who are the people in the room? I will give an example. Who is supposed to make the commitment? You are a governor, you are looking for opportunity to win electoral votes, and you promise free health care. That is the most commonest, buzzword. So, who is making the commitment? Who is shaping the idea for a politician to even make the commitment in the first place? If we understand that, then you begin to now look very closely to how even the plans are being developed. And if you take a closer look to how our politicians make such type of commitment, you will see someone gunning for Senate making the same commitment as a chairman of a local government: free healthcare, free healthcare, free healthcare. How on earth can you provide that? So, having looked at that, and from my own experience, I realized that one of the biggest barrier after all the commitment, because the right people are not making the commitment, the right people are not in the room where the commitment is being shaped or communication is being packaged for them to make those commitments, then you now face a host of barriers ranging from even the financing. I'm sure you just mentioned something about 15% Abuja declaration. If you look at that 15%, 70 to 80% are projects. What is the return on investment in providing the needed resources for immunization, for outreaches, as compared to building a new secondary facility? So financing is a very big problem. So you might have the resources, you might release the resources, but what is it spent on? That is one. Secondly, and a big elephant in the room from my own perspective, is the healthcare workforce. If you invest, for every $1 you invest in healthcare workforce, you have $10 in fold returns. In short, if you take it down to community health folks, you are almost getting closer to $20. Is there any political leader that understands that and use that as a political dividend to win an electoral vote along the line? They don't get it. And if you don't have the right people in the room, you will not get it. Another aspect is data. What is the data available for a political leader to make the necessary commitments? So those are the kind of barriers that we're facing. And in Niger State, I think when we came on board, one thing we did differently in designing the new Niger Health Agenda was to bring, I remember my brother is here, Dr. Lass, is to bring people that truly needs to make those kind of plans available to our leaders, our governors, our senators, so that when they are prioritizing their commitment, they are very specific. Like, it's very simple, and I probably will end here. My governor woke up and said, I am not going to build a new primary health care. People are like, no. That we actually frame that because we want him to focus on those existing primary health care and take them to level 2 primary health care. Not all primary health care are primary health care, and we know that. We have over 1,500 in Niger State. But are they level 2 with full complement of services, perimeter fencing, accommodation, solar-driven borehole? Those are the commitments. And when he came on board, he said, I'm going to build 100 primary health care in the next 4 years. It might look a little bit small, but those commitments are exactly what we are living. Right now, we have done 20, and in the next couple of months, working with partners, UNICEF, Impact Project of World Bank and federal government, we are going to build 100 level 2 primary health care. Not new, but from existing primary health care service. So it is important to have the right people in the room when you are making those kind of commitments to help you prioritize, to help you design the plan, so that when you are making pronouncement, people can able to track you. I will be surprised if we get enough results from tracking manifesto. Which manifesto? How will you track and measure free medical services? It's difficult. So if you are already tracking manifesto that is 40 in the first place, but if you have the right people in the room to make the discussion, if you have the right people that will prioritize, and I'm sure the commitment will be right. Finally, please, like in this room now, we're all health experts. I have seen a lot of faces in the last 10, 15, 20 years. There is no commissioner of budget here. There is nobody from... That is even where we are getting it even wrong in the first place. So those are the kind of conversation that needs to happen. So health is a very strong political dividend that needs to be discussed. Thank you.
Thank you. Rightly said, Dr. Bagana. Indeed, extending beyond this space where we are, I'm speaking about the health space, is absolutely important. In fact, it resonated at the last strategic roundtable that we had on maternal health, because you can't be discussing financing and those system strengthening without the people holding the purse in the room. And I believe we are doing it together in terms of expanding that space. But I'm also grateful that you put this in perspective, in the sense that who is actually advising this agenda and manifestos and promises that we get from either the governors or even the health commissioners when they set their priorities as they come into office. And I believe Dr. Gafar is going to shed more light in terms of the role that the civil society plays, and also how the citizens' voices can be included. So specifically, sir, as you respond to this question, I'd like you to also include what Dr. Bagana has said, because it's important to also clarify over the years the efforts that I know that civil society has made to be part of shaping this conversation and agenda for the health system. So as Nigeria approaches the 2027 elections, being mindful of where we are, what should civil society do to help citizens hold political leaders accountable and ensure that health financing, policy, and service delivery, like Dr. Bagana has highlighted, remain visible priorities? Just help us put that in context. I know he has poked some holes in this argument, but I know that you can also put it in perspective for us.
Okay, thank you very much, Sophia. And to start with, let me thank the Nigerian Health Watch for organizing this very important conversation, for inviting me to speak. The Honorable Commissioner set a very, very good stage for this conversation. I'm very happy that I'm building on it. I would like to respond to your question by looking at three important things. One, what have we done? What have we learned? And what should we do differently going forward? So I remember sometime in 2022, after the usual lamentation about the state of health in Nigeria, and very early in the morning, our mother in the room, Chief Moji, called and we started the usual lamentation. I said, wait a minute, can we close the book of lamentation for a while and open, the book of hope in terms of what we should do differently? And we started discussing, okay, countries that have made progress. My brother here presented Rwanda, Thailand, another addition is Ghana and some other things. What did they do differently? A wise man once said, if you want to solve a complex problem, ask two questions. Who has solved the problem before, and what can we learn from them? Then we started discussing, okay, what is common to all those countries that made very, very good progress is that they started their health reform as a political process, not a technical process, as we usually do and other stuff. And they took advantage of election period to set the right agenda and sell the agenda to the political class. And that becomes the priority that was implemented. I said, okay, understanding that, what should we do differently in Nigeria? I started thinking. I would say, okay, probably we should look at the 2023 election. So we say USC 2023 as an agenda. That's the name we gave it then. Then what we did, a couple in the interest of time, that speaks to what the Honorable Commissioner said. We said we cannot just be talking to the politician and say prioritize health. What exactly should they prioritize in the health sector? And that was why we came together under the umbrella Nigerian UC Forum to bring different stakeholders together. Say, let's set a citizen-led health agenda that clearly articulates what the problems are, what are the priorities, what is the intervention with evidence, so that we use this citizen-led health agenda to engage the political class, including the political party, and which we did. So we engaged the top political party then, APC, PDP, LP then. I don't know the fate of LP now. But so we engaged them. We went to their offices and we organized a meeting with them, and where we look at the citizen agenda. And interestingly, a lot of recommendations that we made into the some of the parties, especially APC, especially in terms of priority around health insurance, specific number, what to target, and everything. Human capital development, thank you very much. We articulated in a number of areas. We did not stop there. We went, because the real action is at the state level. In a number of states we went there, we engaged a dialogue. I remember in Kano, the president governor of Kano was part of the dialogue that we had, where we presented the agenda, and then we had this symbolic signing of commitment card, very large card where they signed and all those stuff like that. And we did that in Lagos as well. We had a couple of policy dialogue at the national level. So, again, the next level that we have to look at critically, so we defined health agenda, part of it made it into the manifesto. But where was the gap? The gap was that the political leadership that we engaged, when it comes to certain priority, they brought another set of technical people as commissioners, as ministers, and everything. That you are not able to translate even what is in the manifesto to their priority. They had a different set of priorities at the same time. But again, it's a lesson, and it's a process that we have to continue to build on. Now, in terms of what we have learned, so we were very active pre-election period, but not very active post-election. Now, part of what we have to do differently is to revisit the agenda, because things have changed. 2023 is not 2027, and now I will highlight a number of things that have changed. The fiscal context has changed. The states are now richer. Commissioner, I'm very sure you are richer now. Exactly. You understand? And at the same time, we have learned a lot of things between now and then. Nigeria, we frame the health issues usually in the negative terms in Nigeria. This is not working, this is poor, this is bad. And when we are looking for references, we go to Rwanda, we go to other countries. Things have really changed. There's a project that my team in DGI is implementing, supporting the Federal Ministry with funding from Gates Foundation. They are looking at exemplars in health system in Nigeria. And interestingly, you see a lot of interesting findings. Ondo State reduced neonatal mortality by 90%. That is what you are not likely to see in the literature globally in terms of what that is. So for those of us that are familiar with the health system, one of the difficult things to do is to reduce maternal mortality and reduce neonatal mortality, because they are strongly linked to health system. Kwara State reduced under 5 mortality by 80%. Lagos State reduced stunting. I'm talking about impact level data. Lagos reduced stunting by 60%. Edo reduced under 5 mortality by 75% or thereabout. What you call it, the Katsina increased coverage by almost 250% and all those. Now, when we are articulating our agenda, it's very important to say so that we are not saying improve health system as a foreign thing. It's something that we have evidence for locally. So as we are articulating our agenda, we put it as part of our agenda. Some popular people have done it before. We want you to do it and everything. And another thing that has changed that we have to take into consideration, I talk about the fiscal environment. Fiscal space has changed. Every state receive more than twice or triple what they used to receive in Naira terms, because if you convert it to dollar, it could be another thing entirely. But notwithstanding, it has created better fiscal space. So to me, going to 2027, we have to come together again and visit the citizen-led health agenda, and make it more succinct and make it clearer in terms of what we want parties to reflect in their manifesto. Because like when I said, Honorable Commissioner said the state, that's very powerful one. Because what you see in the manifesto is something that's not very, you can't track it and you can't hold them accountable for it as well. And again, the job should not stop there. When the manifestos are there, we should ensure that the political class, by the time they are bringing their commissioner and minister on board, they are able to speak to what is in that manifesto and is formed the priority. Because what we have now, in most of the parties at the national and state national level, the priority of what the ministry and departments are implementing does not align with their manifesto. So those are the things we have to do differently, learning, building from what you have learned in the last election cycle to redefine the citizen agenda, to ensure that shape the manifesto, and to ensure that the manifesto translates into the priority of government. And that is the priority we are going to be holding them accountable for. Thank you very much.
Thank you, Dr. Gafar. I appreciate how you really, put that in faces for us in terms of what we did and what we've learned. It's really important for us to know where we're coming from and, how we're going to build on those important lessons. You also responded to the issue of having the right data to support our honorable commissioners and other key stakeholders in that space. Also, I'm picking that there is definitely more targeted investment in terms of tracking, because even though there is sometimes a misalignment in terms of the priorities for who comes into office to lead these very key positions, if there is something that we can hold them accountable to, it goes a long way in making the difference. So I just have one more set of questions for both panelists, and then we'll open it up for us to interact amongst, because I know that I can see a lot of experts in the room who have examples and lessons to share with us. So we'll just keep it one more round of questions. So, Dr. Balkana, I'm coming back to you. So just picking up from how we want to be intentional about tracking, what advice do you have? Because I'm leaning into, your experience coming from the development space to now occupy the elevated office of Honorable Commissioner. How do we ensure transparency from your office and the office of your colleagues in terms of the priorities for health? How do we do that at civil society and also as citizens?
Okay, thank you very much. I think for the first time in a very long time, we are beginning to get it right. I'm happy to state here that when the Nigerian Health Sector Renewal Investment Initiative was signed sometime in 2023, I think December, one very key component of that is not, of course, for us at national and state level to wait until the next NDHS or any of the immunization cluster surveys in case of immunization. But it's also to find a way to engage not only the Forum of Honorable Commissioners, which the Honorable Coordinating Minister of Health and Social Welfare is currently doing, because we have a quarterly engagement at the level of the Ministerial Oversight Committee, the MOC. That is currently happening, and it is all data driven. But the issue with that is, okay, it's going on well at national level. Is it published the way we'll interrogate the data? That is another conversation that needs to happen. It is not enough to say, oh, Adamawa is doing well, Kaduna is not doing well, Niger is not doing well, or is doing well. But where are we doing well? At the state level, unfortunately, and I'm sure maybe my brother will add, we do not have those level of engagement with the local government. In short, to even start with, how many of us even have regular disaggregated data that can inform decision making at local government? The local government chairman and the director of the primary health or health, do they even understand the data? How can they use that for decision making? So we are not there yet at the lower level. So one of the things we tried to do in Niger when I came on board was to critically, and my brother just alluded to that, to critically examine some of the gaps. And one very big gap that we noticed, and which we borrowed from the national, was around coordination. So we translated the sector-wide approach office down to the state level. We created what we call the delivery unit. Everybody here knows the importance of incident management approach to making sure that even those commitments, those political commitments, translate to tangible results. How do you expect a commissioner for health to sit in his office and wait for 1 to 2 weeks before a memo moves from a parastatal under him to his table? I have all my MDA heads sitting exactly the way my senior colleagues are sitting. Insurance is here, agency is here. So coordination was very, very important. And if you have a memo, just pass it on. Don't pass it through one PAMSEC or director. Just give it to me and I will sign. If you need my electronic signature, I will give it to you. It is just so bureaucratic. So what am I trying to say in essence? We have started on a good trajectory at the national level under the health sector renewal investment with the basic care provision fund and the medical industrialization. Good. We are already having a quarterly engagement with the commissioners, with policymakers and everyone in the table, civil society organizations, and even the commissioners are meeting. But that is not happening the same way at the state level. I think that is another level of social accountability that we expect the CSOs to come in. And also, finally, providing the necessary information to drive accountability. Sometimes the way we package data, if I tell my governor now to invest in immunization and it will yield dividend, how do I make that presentation that $1 in immunization will yield $20 in return on investment? One on nutrition will yield 23. One on workforce will yield 10. One on maternal services will yield, but one on infrastructure might yield $6. How do you package work with CSOs to package that so that at the end of the day, when they are looking at transparent data and accountability, they will realize, even if it is not in their lifetime, that those investments they made in health are not expenditures, but truly they translate to dividend along the line. So those are the things that need to happen at the local government and the state level. But currently, that is not the case.
Thank you, Dr. Bagana. This is quite informative. And I want to say that a number of things really resonate. The issue of having to do away with that bureaucracy of memo writing, or rather improving that process so that it speeds up projects or implementation at the subnational level. And again, packaging data in a way that it is consumable for those that are not technically inclined in that field, and how it also appeals to our governors and other executive offices. Again, this really resonates, and I believe it does lie with us, Dr. Gafar, civil society, as the media, and even as individuals who are privileged to understand this, to be able to communicate it in a better way. The return on investment goes beyond just the monetary value. It's the ability for all of us to wake up every morning agile, productive, and to go about our daily lives, you know. So just being able to put it in a language that it appeals. Dr. Bagana has given some way forward, or, you know, how will I put it, some advice on how we can do it better. But I'd like to hear from you, in addition to what I know you already have planned as UHC. How do we carry all of us citizens along so that we are all interested in tracking these manifestos or whatever commitments that our policymakers made or make during this period of electioning? Thank you.
Okay, thank you very much. So again, I would like to look at these more broadly in terms of accountability at three important levels. One is the policy accountability. The other one is financial accountability. And the third one is social accountability from the community. We have to link the three. Because what we usually do at times is focus on one and leave others. And they are interconnected. Because policy has to drive the spending. Spending has to drive the service delivery. At the policy accountability level, so in December 2023, so there was a compact signed between, Mr. President was there, the Honorable Minister was there, all the governors were there, and the partners were there. There was a compact sign that this is direction, this is going to be the priority and everything. Between then and now, we have not had much in terms of what has happened. How has that compact translated to investment intervention? But the good news is that we have two ancestors in the room that are doing very, very, very a great job. You know, we have the Galadima out here, we have Antimuchi there, leading the HSRC and Nigerian USC Forum. They have put together a mid-term review, sort of, which will be happening, so a permission to announce on your behalf, which will be happening on the 14th of September. They look at the state of the compact. You know, in the US, they say the State of the Union. Like 200 years back in the US, there was an agreement that United States, you know, at times when we are calling United States agreed to come together to form a union. And from time to time, they check the state of that union. So our ancestors here, they want to check the state of the compact, where the minister himself will be there will be fireside chat with the honorable minister and everything. I think we need more of that at the level of our policy accountability. The honorable minister has told us this is the policy priority. And people ask questions. Civil society will ask questions. Media will ask questions. I think that is very, very important, and thanks to HSRC and the USC Forum for putting that together. We need more of that at the level of the policy accountability. With regards to financial accountability, there's a group that was trying to look at, in the last 3 or 4 years, states are receiving more money generally. So what has happened to health spending? And they discovered that some states, general revenue actually tripled to the state. But in some of those states, health spending actually increased, but not in a commensurate term. Unfortunately, in some states, despite the increase in revenue, expenditure on health went down. And you can easily explain it because if you look at other countries' experience and everything, as states get more money, the desire to do more infrastructure work increases. And which sector is going to pay for it? In most cases, social sector. Sector where you don't easily see what the government is doing. You understand? So in line with the data that the Honorable Commissioner is talking about, so those groups, they are in the process of publishing that. But that is not enough. It's not enough for you to have access to data. Transparency is the starting point of accountability. There is still more thing to do. Somebody has to use that to engage and say, and one good thing, Nigerian Governors Forum is there. Part of what has really worked recently, states don't like peer comparison. Especially when you do peer comparison and use red and green, that you are doing well, you are not doing. They are very, very sensitive to it. Governors, absolutely. I've been trying to be diplomatic because I know you are representing the governor. So they don't like peer comparison. We use it a lot when we're trying to encourage states to put money on equity fund. And one of, after the Nigerian Governors Forum meeting, so one of the governors went back and called his people. I thought you said we are doing well. Am I red and others are green? I said, Your Excellency, we are doing well. It's only that you are not releasing equity fund, and that's why you are red. So how much is that equity fund? Okay, let's approve it and everything. So we have to look at what works in terms of holding the political class accountable. So we have to use data, correct data, because if the data is somebody that can easily be punctured, it doesn't work. But coming to the social accountability, I think that is where the real work is, and that is the most challenging one. And we have to be more intentional about doing that. And that is why the media is very, very, very important in terms of engaging the citizenry. The other time the minister was talking about, okay, basic care provision fund, people should track and everything. I'm wondering how many people actually eventually go to their basic care provision point. So I think that is where we really need the media to sensitize the populace about this is the government policy, this is what it should be. These are rights, you understand. If you're in basic care provision fund, it's a basic facility. If you are enrolled, you are entitled to this, and this. And you should be able to ask for it. And again, leverage what works as well. Many state health insurance schemes, they have what they call grievance redress mechanism. If you are enrolled, if you don't have access to what you are supposed to have access to, there's a number to call that is, and so some of these things are actually working. The most important thing is that how do we escalate? How do we, ensure that it is nationwide and we build the capacity of citizens? And that's why the media, both the traditional and new media and everything is very, very important. And again, I think we have to strengthen our civil society coalitions. So I give it to HSRC and Nigerian USC Forum. How do we ensure that civil society coalition are not Abuja strong and community weak? How do we ensure that we're able to bring everybody together, a way of ensuring that whatever it's decided at Abuja level, it gets to the nook and cranny of every community. I think those are things that are going to be very, very important as we move to 2027. Thank you very much.
Thank you. Thank you so much, Dr. Gafar. Political and social accountability, and we have the midterm report to look forward to. And thank you so much to our ancestors for taking charge of that really engaging conversation. I would like to open the floor now. We want to give 20 minutes and for the questions and comments. I want to make it in a way that I'll take 5 first, so that I'm giving you a minute and a half to make sure you deliver your question smartly and quickly, enough time for the other 4 people to also give their questions. So can we have a roving mic, and I will pick the first 5 hands I see. 1, 2, 3. 1, 2, 3, 4. Oh dear. Okay, I already have 4 from the first table. 5, 6, 7. Okay, Auntie Moja, 8. Oh, okay. So please, let's use 1 minute each so that we have enough time for some responses. Okay, and I have online participants as well. Okay, let's start.
Thank you. Thank you very much.
Dr. Amina, sorry, as you ask your question, I also want to ask that you make one comment regarding the local government and state level, please, because I know you have that knowledge and it would be beneficial for us. Thank you.
Thank you very much. Good morning, everyone, and I really appreciate the opportunity to join this important conversation today. And thank you to those very insightful comments from Honorable Commissioner and my brother from DGI also. I think for me, I resonate well with most of all of what you said. And I think the first thing really that I have that I've been thinking about for quite a while is even the leadership at the state level, especially. For instance, now we have Dr. Bagana, who is really very focused on development, on progress, and understands the issues. We don't know whether Dr. Bagana will be here in after 2027, and I'm being very honest about it. And that is why, how do we engage governors to keep people like Dr. Bagana, for instance, who are already part of this system and know? I'm being very honest, because when you talk about policy and political, agenda and political accountability, that's one of those things. Leadership is very critical. Tomorrow, you talked about, how you are trying to reduce bureaucracy in memo, processing. If you're not there, that will continue. So I think for me, it's also one thing that citizens can do is to really identify those exemplars in terms of leaderships and also propagate and, present them to the governors or to the leadership for us to continue at least for a couple of years so that this progress will be sustained. The second thing I wanted to talk about, Dr. Gafar has said it in passing, I think we have to also very well utilize technology, because you see a lot of discussions trend on social media. Our young people are very social media savvy. Unfortunately, health doesn't trend as much as it should. A lot of, I don't want to say useless, but things that are not really progressive are the ones trending, especially in my northern Nigeria counterpart. So how do we engage more young people as part of the CSO capacity building to make the health issues trend? Because sometimes what trends are what gets attention and what gets responses and reactions from the political class. So we are moving, as you said, 2023 is not 2027. In 2023, this may not be a strategy, but really in 2027, let's try and use what is available and what has worked for other issues that are even not as important as health. So the third thing is that I just want to continue to say that for local governments, I think there's a lot of, as Dr. Gafar mentioned, more money is coming in terms of Naira amount. Of course, we don't know about the value in terms of dollar, but is that money really reaching the local governments? I think we all know the answers. And I think if we push for more accountability so that states and local governments have this understanding, and we are able to, because we can't really hold someone accountable when there's no authority or there's no financing. So I think for me, what citizens can, us as CSOs can do more of, is to also push for more, accountability, more financing at the local level, because that's where many things happen, and that is where our citizens will feel the brunt. Lastly, as I must say, is information. And still, Dr. Gafar talked about it. We as CSOs, we're doing a lot at the Abuja level and maybe even at the state level, but a lot of the communities don't even understand our language. They don't understand what Basic Healthcare Provision Fund is. And just today, I was coming out of the house, and the lady staying with me, her son just came, about 30 years old, and he was ill. I had to cough out 20,000 from my bag to go to the hospital. If I go back now, whatever test that has been done, this is a government hospital we're talking about. I don't know how much more we'll spend, because he's not captured, in the health insurance scheme. So these are realities. And so when I came here and this discussion was happening, I was like, this is even happening to me particularly. Even if I am insured, the people in my community and my home, is everyone insured, my neighbors. And these also, the brunt is on many of us. Thank you.
Thank you, Dr. Amina. So, Dr. Gafar, I think the first point I would appreciate when it's time for you to respond to that. How do we keep people that are doing well in office? Let me phrase it that way. Next, please. Thank you.
Okay. Thank you very much, the panelists and Nigeria Health Watch, for putting this together. Thanks, Dr. Amina, for those comments. It's captured part of what I wanted to say. I lead the hospital work campaign, and a model which we push, which many organizations have also pushed, is community component, and I want to come from there. Looking at demand and supply component to this conversation, demand being the people, the citizens, and supply being the government, and the healthcare providers. It's been mentioned that awareness is quite low, citizens' awareness, and that's why it's not trending, because people would not really do much about what they don't understand. And that's an area we need to do more, because the health sector is quite complex, and even for those in the sector, you see yourself working in the immunization space, and you move to cancer, and it appears like entirely a different space altogether. So much more needs to be done in that area. And also the community component. I've tried to push over the years certain things to be done in my community as an individual, and also for the formation of health committee. I was running away from taking that leadership position, but earlier this year I accepted, and a lot has happened. My eyes has opened to a number of things, and I want to encourage us, everyone in this room, to kind of pay a bit more attention to that, because as advocates and as champions, all the policies we are pushing here, is it happening? I've tracked the Basic Healthcare Provision Fund and looking at what is on paper going to my state, and out of the 171 focal health facilities, the one in my ward, or in my community, there are at least, my immediate community, there are at least 2 wards. What they are getting, or what is in practice, substantially deviates from what is on the guideline and what is supposed to be. Of course, it's something we are doing more deep dive analysis, doing health facility assessment. A couple of days ago, I got a report of PHCs in my community along the 6 building blocks of the health system, and we are going to be engaging at the local level in that regard. The impact project, substandard job is being done in my own ward, and I've been following this up since October last year. Unfortunately, over 90% of the issues raised has not been addressed. I've taken out the commissioner, out to relevant government agencies. I'm giving these examples because until we begin to get at that level, even as health experts, even as advocates, just start from your own ward and community and begin to track all the grammar we speak in Abuja here. How does it translate? Get across to anybody, the relevant stakeholders, and put these issues. I worry a whole lot of them. Some have stopped replying me. And when I get tired of those behind the scene engagements and I'm not getting results, I take it to the next level, get to social media, even get on radio or TV, and begin to call them out. If they like, they call it politics. It's welcome. Health is politics, and it's about development of the people. So that's a recommendation I want to make. And to ask now the commissioner, from your experience, how do we get this message on the demand side to resonate? Yes, we are civil societies, and sometimes we think our approach is working, maybe pockets of successes here and there, but as someone who sits in government and sometimes know that when people begin to talk certain things, they are more likely to get government action. What do you recommend for us to do differently in terms of mobilizing the citizens to use the appropriate language that the governors are going to listen to? I often argue that our health sector lies more with the states than federal government. If we have 20 out of 36 states step up with the governors making right investments, we are going to see it reflect substantially in our national health indices, because majority of the health facilities are either owned or under the control of the state, including private. It's the states that give them license to operate, and not federal. PHCs through the agencies are also under the states. So when we get this right at the subnational level in terms of monitoring, in terms of funding, in terms of everything, then it will reflect most substantially. And lastly, getting this into the manifesto, and not just manifesto, health plans of the government. The commissioner mentioned me along the line. I was part of the Abia State Transition Council. I'm not from Abia, I'm from Ebonyi. But because prior to election, I got a lot of reports from Abia when I was doing TV show. And I took a private trip to the States, visited health facilities, including the teaching hospital that was under lock and key. The things I found out were, I was too ashamed to bring it up on TV. But I made a policy recommendation, reached out to the governorship candidates, the leading ones. Not all of them responded, but OT responded. And I visited him, and we talked. And when we were talking, I asked about his health agenda. He talked about medical city and other plans. Then I gave him a data that over 80% of our health needs can substantially be addressed at the primary care level. Of course, as a banker, as a big player in the private sector, they often, have this idea about big projects and medical tourism, and he said that data struck. Oh, I never thought about this. I've never come across this data. Yes. And that changed it for him. So when he won, he invited me to join the Transition Council. Okay. And we're part of those that did the health agenda, that is being implemented. During that period, the commissioner was also working in Niger as part of those preparing the health distance. So many of us as experts should make ourselves available, whichever politician or political party you like, to begin to find yourself in that room to include those things. Yes. Even though not all might be implemented, but if they choose to implement it, like they are doing in Abia State at the moment, you'd be happy that some of these things we are preaching is getting into places where they could be acted upon. Thank you very much.
Thank you very much. So, Dr. Bagana, you are going to share with us the kind of language that would resonate with you when that time comes. But let me just take 2 more questions, and then we will take your responses and then continue with the selected questions. So, yes, sir.
Okay, thank you. I would like to stand on existing protocol. I would have loved a situation where instead of reacting to what politicians or those in power are saying about the health sector, to help them rather to set the agenda. If the issue of health is problematized enough, you can begin to see those aspiring to power making the agenda known. For instance, the fuel subsidy challenge has become so much problematized. Atiku has come forward to say, I want to deviate from the current practice. So the agenda is not on the table and is being discussed. Because at the end of the day, even if he doesn't win, it may force a shift if he makes sufficient information available that what he's planning to do may be in the greater interest. So that's number one. Secondly, if you look at the example of education, education was able to articulate what I consider the minimum core content of the right to education, to say it is basic education. And on the basis of that, the Universal Basic Education Fund was set up, which is 2% even bigger than our own health fund. On top of that, the law made it compulsory to say you must send your ward to school, even though we are not implementing it. And even provided sanctions for those guardians and parents who felt neglected and refused to send their wards to school. Can we have such articulation in the health sector to define the minimum core content of what the state must do as a matter of obligation, on which rights can be premised and citizens can claim to say as rights? Finally, we are very good at making laws and policies. We made a lot of noise about compulsory health insurance regime for financing. Since 2022, we've got that in the law. The law says it's compulsory, it's mandatory, everybody's got it. And those who are not able to get it, the vulnerable group fund, the government has to pay for them. I remember an agenda was developed, which was even launched by the Honorable Minister sometime in December 2023. And thereafter, the then ES was removed. We've had a new ES. For 2-3 years, everybody's been marking time. Nothing, the needle is not shifting in health insurance. And there is no way we can make a lot of progress if we don't get up to 30 or 40% of Nigerians compulsorily insuring themselves and bringing a pool of, say, 5 to 7 trillion every year, which when you add it to government revenue and the money that is coming from the government, you'll be discussing a pool of 13, 14 trillion every year to be spent on the health of Nigerians. So I think we need to interrogate this further and call those who are responsible to account. Otherwise, this is a discussion we had 10 years ago. We may come back the next 10 years and still have this discussion.
Thank you very much, sir. Dr. Gafar, I think those questions are mainly for you. How do we not just problematize it, but keep the conversation, and whether it's possible to actually design a minimum threshold for what it means to provide accurate and improved health services. So, Dr. Lekki?
Yeah, thank you. I want to speak 2 or 3 main points. One is that first to acknowledge that we as CSOs have a lot of power, but we often, unfortunately for various reasons, drop the ball. If not for the CSO, we will not have a National Health Act today. And if not for National Health Act, there will be no basic healthcare provision fund, which is driving reforms across the country, right? So you see our power we can do, but in some very critical areas, we drop the ball. We need to remember that we claim, and rightly, that we are the people who are supporting the rights holders. That's what we profess. The rights holders are people in the communities. So we need to find a way to reset that. I don't think we need to reset any agenda. Let me just make that provocative statement. It's not about agenda setting. We have many agendas. They are staring us in the face. All the compacts are agendas. And so we should speak to them, because these have been signed on to at very high level. At international level, we have the SDGs, right? We're a member of it now. We are prosecuting it. We are going to deliver on it. At national level, a couple of years ago, we did the National Compact, right? Which have been domesticated to even community and state level and non-state actor. We signed as CSO. So this is the agenda. We should be holding ourselves responsible. This thing that we signed on to as chairman of local government and governors and so on, where are we with that? And then we can build all our dashboard and scorecard around that going forward, right? Asking them to speak to it. There was a meeting that was held in 2014 when Ngozi Iweala was still the Minister of Finance. I think it was a novel idea. It was an interministerial meeting of health ministers and finance ministers. And you can imagine what that was supposed to be. I was in the LOC committee as a secretary. The idea was to forge and institutionalize this process whereby the ministries of health and finance speak, they meet together and speak on the same issues going forward. We need to institutionalize that going forward. Because we're not talking with Ministry of Finance and the Budget Office, we're not getting the release that we want because they don't understand. We need to learn economics and learn finance, speak the language so that they can understand where we are. So that is something that was called for as a key recommendation from that meeting, but nobody was assigned to do it. So nobody is doing it. So there are many such things that are just hanging, but nobody is only the responsibility to do it, and here is where the CSOs can come in. So going forward for us, we can institutionalize a process whereby the ministers of finance and health will be meeting on a regular basis. Maybe it's biannual meeting. That's our responsibility to convey, so that we'll be speaking to the budget and speaking to these releases. I also think that one other thing we're not doing very well, because we're talking about how do we get things to happen at the community level. The community governance level on primary health care resides with the community health development, district health development, the CWDs, community development, group, WDC, World Development Committee. That is the governance for primary health care at the community level. Are we there? Do they know what is happening? We have worked in about 23 local governments in Kaduna recently. We found that most of the WDC know nothing about basic health care provision fund. And they are the governance and the hub for primary health care at the community level. So we need to be speaking to them. We need to energize them to make sure they have the right information. But like I said also, we need to stop talking about setting a new agenda. The agendas are all over the place. So let's speak to the agenda that we currently have. Let us build this relationship between health and finance and make it established as an ongoing process of meeting and speaking to each other so that the releases can be done. And let us strengthen the hub for primary health care. Governance hub for primary health care is WDC. Yes. Let us do that. Thank you very much.
Thank you, Dr. Lekki. So while we're championing accountability, we also need to hold ourselves accountable as civil society. That's a very important note for us. So Dr. Gafar, I'll start with you, and then we'll come to the Honorable Commissioner.
Okay, thank you very much. So let me try to address a couple of points here, perhaps that would have implication for others as well. So if you look at most of the conversation around accountability, and of course the bulk of it rests on the harm of the civil society. But I want to ask a very provocative question here, probably not a question. How do we reposition the civil society space in this part of the world? That we have civil society structure that is not only strong at the Abuja level, and that is able to connect with everywhere. Because it's like we know what to do, but we don't have strong structure to get it done. And again, we have to look inward. One of the main challenges will be financing the civil society work. Civil society work in this part of the world is heavily supported by donors. And European people say when, what do you call it now? When you meet somebody in the vehicle and you are so happy, you're a co-passenger, you are so happy with the discussion, you'll soon be disappointed because that fellow will soon leave you. You understand? So there's a critical conversation we must have, is that how do we finance civil society activity? I don't subscribe to civil society activity being financed by government. How can somebody pay you and you are holding that fellow accountable? That's out of it. In fact, where the civil society work started in the developed world, started with few individuals that are so committed to certain causes. I don't care whether somebody fund them or not. And they go about mobilizing other people. I know it might be challenging to use the same model, but it's a critical conversation we must have. How do we, because it's like when everybody spoke in different corners of whatever they are doing something. But how do we bring everything together to ensure we have a sustainable financing and self-accountability as well to do our work? Because the truth of the matter is that, of course, I've been in this space for more than 2 decades. And what people do is what is financed by donor. And if donors say family planning is the focus today, everybody will move there. If donors say maternal and child health, if it is cancer and all those stuff, no society developed like that. We have to be very, very intentional about what is our own priority and how do we get money. In other climes, when I was doing my master's in the UK, we used to raise funds for civil society organization. We would knock on doors, and people will be committing $1, £1, £2, £3, and all those stuff. And they'll pull all those money together without waiting for one large donor agency. I'm not saying we should do exactly the same, but we need that critical conversation in this part of the world. Because even when we know what to do, when somebody financing from donor space does not believe in what we are doing, he does not prioritize it. And you see a young boy that just finished internship 2 or 3 years after coming from, because he has visited Ukraine, visited Tanzania, is coming to dictate to you what you should do here. No, we have to have that critical conversation. They're very important. How do we organize ourselves better? That we have a network, a nationwide network. And like Dr. Lekki said, probably looking at the existing agenda where we need to add to them and ensure that that percolates everywhere in terms of our standard. I think that is going to be critical. If we don't do that, we just come here and talk about, say, this is what's supposed to do, this is not what is working out. It's a critical thing that we have to look at. So you asked me to talk about...
how do we keep those that are doing well?
Okay, great. So Chief Oji and I had a conversation around, for example, how do we do like health leadership mapping statewide, nationwide, to look at in each of the states, who are those people that have demonstrated the capacity and the leadership? Because it's not only about the capacity. There are people that have technical capacity, and if you make them commissioner, they make the situation worse. Because they understand the loopholes and everything, and they'll do everything to their own advantage, not the advantage of the system. 10 years, 15 years ago, I used to think, oh, when somebody has excelled very well in development space and all, just go and make it the commissioner, everything will turn. It's a lie. Not necessarily. So what is very important, as we are doing our health leadership mapping, people that have demonstrated capacity and leadership and passion for reforms are very, very important. We have to make it happen. But at the same time, we have to understand the reality. A governor is a politician. You understand? And probably the first consideration is political leverage as much as possible. But notwithstanding, maybe if you're able to do that, maybe there will be a few states where we'll be able to say, oh, Lars, okay, you have done very well, maybe we recommend you to the governor, but the type of his political whatever might not put him in a very good position to achieve that enabling. So that's just an example. I think, again, it's something that we have thought of in terms of health leadership mapping and being intentional about engaging the political leadership, especially during the transition period, make some recommendation. But what is important is to look for leadership quality. Because if you look at people that have done very well, the major reference when it comes to good health leadership in Nigeria in terms of minister is Razon Kuti. Razon Kuti was a pediatrician, not somebody that has all the health policy and public health and all those stuff. But he demonstrated character. He knew what to do, and he has the integrity, and he has the respect of the political leadership to give him the necessary bandwidth to do that. Oh.
Thank you very much, Dr. Gafar. Really appreciate you putting that in perspective. Dr. Bagana, we're coming to you, and just to address the point from our elder statement about the threshold for health, whether it is possible to design something that is similar to what we have in the education sector, and also to talk a little about the language that needs to be presented so that policymakers prioritize health. I think that conversation still needs to come out clearly. Thank you.
Okay, thank you very much. I think I will probably just draw on the question that also Dr. Lars put on the table around what the CSOs needs to do. CSOs are not foreigners, but the attitude is like they are foreigners, and they know it all, and they seems to, I'm sure that is probably why Dr. Amina mentioned, they are heavy Abuja, but weak down there. So if that is the case, I think most times, because of the way news flies, bad news make more sense. So you see a CSO in Niger probably want to talk about rats, rodents in my primary health care. But we definitely not talk about a standard primary healthcare service that runs 24-hour services, is fully automated and provide the kind of citizen engagement that we all preach here. So as commissioner, what I feel works, especially from that demand side, is, flog me, no doubt. But can you also, be honest to talk about what works, what is working, even if it will not attract you the next funding? Can you be honest to, because we know this attitude of copy and paste. When you want to write grant proposal, we know how you start. They have weak capacity. They do this. We have been in this space for a very long time. So, as political leaders, we want to also be pampered. Sorry, I'm using that word, but we truly want to be pampered. We want you to hold us accountable, but tell people the things that we do that are also. If we hear that quite often, if you get to, see rats and rodents and drugs are not available, we'll take you serious. That is one. Secondly, CSO, since it is top-down approach in our social accountability, is it possible that we pay more attention around building capacity of community structures, traditional they can do a better CSO job than all our, degree. They are actually CSOs. But, like my brother, you mentioned around, the funding is not there. But they don't know how to analyze data. They don't know how to tell people that diphtheria is highly preventable where there are outbreaks. They don't understand that truly that 600,000 or 800,000 that goes to that primary health care, that cannot be released if they are not part of the business plan of that facility. The ward development, like my senior brother mentioned. So I think those are the areas that I really want. But I also want to add to the conversation around the leadership at the state level. Nigerians are very smart. I think leaders are just available everywhere. But I keep asking myself one very important question. As a doctor and someone that has been in the public space, the people that seems to know too much are difficult to subject themselves to learning. And that is where the missing link is around leadership. I will give a very good example. The National Health Insurance Agency is a salesman. Someone that has done and have moved billions to a bank can do a better job than a health economics as a leader in, because it's like selling a car insurance. You want to convince people that it is important to pool resources. It's like Adashi. It does not necessarily, it is an advantage, but it does not necessarily mean it must be a doctor. It must be a, if you can do a better job of selling cars, convincing people to buy houses, people can buy your insurance. So, as leaders in the health space, are we flexible? Do we really understand that context to allow people to even do sometimes a better job? But if you have a doctor that can sell a car better, then he can even do and sell a health insurance better. So those are the things I want to add.
Thank you, Dr. Bagara. Some words of wisdom right there. Thank you. So my next set of questions, please, I implore you to just keep it under 1 minute. I don't mean to, rush you, but it's important that we take as many comments and questions as we can. So please, 1 minute. Thank you.
Thank you very much. I have a recommendation from all the conversation and also a question that I would like to direct to Dr. Gafar. I think I'm grateful that we started talking about highlighting what is working well and not just completely be focusing on what are those things, what are the issues that we've been having over the years. And I'm really grateful for that. I also want to appreciate the effort of Nigeria at Watch, working with solutions journalism in addressing that. My recommendation is around health financing and PFM processes, especially as it relates to health. I think that probably one of the reasons why the Abuja Declaration happened was because prior to the time, we focused a lot of energy and attention on budgetary allocations at the federal level and also at the state level.
20 more seconds.
Of course, and at the regional level as well. But I think that the conversation is now moving from budgetary allocation now to what is being released. I would like to add another layer to that. Let's move beyond also what is being released, because we have a lot of opportunity if we have the pocket of funds that we allocate for health, a high level of that release happening. For instance, if we get up to 80%, 90% of releases of what we allocated for, we will move far from where we are right now. So let's move beyond just budgetary allocation. Let's talk about releases. Let's talk about utilization and ensuring that what was released, what was spent, actually gets to the front line. And we are seeing the results. We're able to track results based on what we actually said we want to do. My question now, wow. I think I would like to stand up here. This is very important because we are talking about political agenda. Yes, and we focus so much on the president, who is going to be the next president, who is going to be the next governor. These are just two levels of politics in terms of governance. What about legislature? I have not heard anything around who are going to be our representatives in the state houses of assembly and also in the National Assembly. These stakeholders are really, really important and critical in governance because they hold a level of power that health needs to leverage. We're talking about BACPF today. BACPF wouldn't have been implemented if not for the intervention
10 more seconds
of the legislature in 2018. Please. They used their power to put it inside the budget, right, for its implementation. So we need to also start looking for political leaders in the legislature that health can use as champions and leverage so that we begin to, they also play roles in accountability, ensuring that they look at the health budget, how it's being implemented, how it gets to the local level, right, what those health funds are being used for, a whole lot of things we can do differently.
Thank you so much.
If we're able to work around the legislature.
Thank you so much. So involving the legislature is critical at this stage. The next question, please.
Thank you so very much. Thank you, Health Watch, for bringing this to fore. But most importantly, I think my co-convener, Dr. Gafar, has spoken to some of the things I would have wanted, to expatiate on. But because of time, thank you, Mr. Commissioner, for speaking truth to power. My colleagues, the media, we need to drive these bottlenecks that are inherent in the slow pace of development, particularly at the state level. I know commissioners that do not see their governors. I know that commissioners will run around to ensure that memos are even signed. And there's something that I share with the Niger State Commissioner. We won't bring it here in the open, but it's about life. And it's about the unseriousness, or whether we want to say the misunderstanding or mispriority of a state governor. We need to engage them. So my thoughts is to the media. We are too pele with them. Let me use that language. I remembered that when we were conversing for polio vaccines usage in Nigeria, we went to the Epic Center, and I was able to speak courageously to the governor of Kano State. You said you are going to stop immunization until you are sure that the vaccines are safe. So what happens to the children that you can easily reach, and those children will remain or are at the risk of coming down with polio? He said that is what we'll do. I said, really? And I used that conveniently as my track-up on network news. The narrative changed. I think for us as journalists, I'm going to speak to us as media because nobody is talking about media here. We have platforms now better than we did at our own time that we can use. And I think we are not doing enough, especially health correspondents. We must align ourselves with what is happening around us. We must be alive because health, they say, is wealth. It is not the same. It is critical for us. We must prioritize health because if we don't, these governors are not ready to do anything. They build hospitals that nobody can use. They do not even understand how the health system works. They do not prioritize human resources. They are not there. They come only when, to commission a small clinic. And, we give them all the publicity in life. As a news producer, when I ask questions. I'm sorry, I'm taking time. So this is what you did. Okay, Mr. Governor, sir. If you want this on, you have to pay for it. Because you cannot commission a 5-kilometer road that does not lead to anywhere, that does not impact on people, that will not help the woman in labor, that will not help transportation, and you expect me to give you, first half of my bulletin, So we also, as journalists, and I'm ready, and I'm sure that within the CSO community, we are ready to work together. And that's why we are having the CSO media review. I think it's important that we are more, we are deliberate in our questions. We must learn how to track budget. We have trained, we have built capacity around this, but I'm not seeing results. And I thank you, Health Watch, for bringing this conversation to fore. I have looked around the hall. I can see some of my colleagues there. They call me ancestor. I'm not ancestor yet. So I'm ready to work with you. But seriously, the media was in the forefront of ensuring and giving visibility for what we talk today about, the National Health Act.
Yes.
The media was there when Ancestor Lekki was ES. And for him, it was not sitting in the comfort of his office. It was canvassing for health insurance. So we need to follow through. The federal government has promised us free medical treatment for women in distress at birth. Do we have the data on that? Are we tracking that? The promise, a lot of promises have been made. Nigerians cannot speak for themselves. We must take the risk of the job, of the calling, and do that ourselves. I'm not here to for us not to, we can accentuate the positive, accentuate the positive, but seriously, yes, we must, is when we go round, and when you help us, I know because some of the media houses don't give a damn about health. All they care about is, promoting the leaders, the so-called political leaders, because of what comes in for sustainability. But if you choose to report health, it means that you have made a commitment to human development.
Thank you.
And I just want to ask us today that we should move beyond our comfort zone. You cannot be a health correspondent and be an Abuja base.
Thank you.
Let's work together. Let's work with the CSO in such a way that we can redefine where we can go. Yes. I know Health Watch does help, to take people to the field. Yes. We also do. As I speak to you, we have health reporters' cells in states that have worked. Everywhere that ISMPH has worked, we have a formation of what we call media cell. Media cell for cancer elimination, media cell for maternal mortality. We can use them. You can get your stories, because those of us at the headquarters have a bit of leverage to be able to promote these stories. We can use that to even promote commissioners that are working, so that we can ask for a continuum. We have a commissioner, the Director General of NCDC, Dr. Jide Idris, got the backing of the media. And so for 8 years, he was Commissioner of Health. He moved from being a permanent secretary that worked and became Commissioner of Health in Lagos State. And up until today, we still celebrate him as the longest serving Commissioner of Health. I'm sorry I'm taking so much time sermonizing. I have to stand up, please. I'm calling my colleagues. From today, let's bring ourselves, special reporters for ensuring health as a political issue. Let's have a cell here. Let's start it this morning. And then have a WhatsApp group and go around. The politicians are now all speaking and they're all making all kinds of noises. Let's stop the noise. Let's sieve the substance and let our people know. And we are not just going to be here. If we are serious about it, we need to advance. We need to speak to editors. We need to speak to the owners of because everybody is vulnerable to diseases. I'm sure doing this, we'll be able to speak truth to power. And Commissioner will promote you if you can get us what we want from this year.
Thank you very much, Auntie Moji. A very, very strong charge and really targeted and specific. Did you hear that? Special reporters for commissioning health as a political issue. You heard it first here, and it needs to happen. Thank you so much for that. That's really forward looking and a very important next step that we need to move on. I will take one more question, right?
Yeah.
That'll be 4. Yes, there's one more in the lineup. Yes.
Okay.
And then, okay. All right, then I'll make it 5. That'll be 9.
Okay.
Auntie? Okay.
Yeah. Morning, everybody. My name is Aro Leonard. Let me thank Nigeria Health Watch for always coming up with innovative things like this. You guys are not that extra big, but you always do wonderful things. These little things, they count. And I want to thank my guys there sitting down. If Minister of Health position was an elective position, we would vote for you guys. Because you can see that they are well-rounded. And I like what Dr. Gafaru said about not every expert you can put in such positions. It's the ones that are well-rounded, who know both sides of it, who can sell things. And that takes me to what my mama, Auntie Moji, talked about, which is what I want to talk about, which is what I've been talking about for the past 2 decades. I used to be head of media development at BBC Media Action. We know that. And we know what BBC Media Action did with the media. We know how BBC Media Action worked with CSOs and then the media and government, connecting those 3 together. And we know what happened with HIV, polio. It was our work. The peaceful elections we are having today. It's the work of that connection, taking policies, taking the strategic knowledge from CSOs, and then mixing it with the media. Where we are having issues now is that the CSOs, the development organization that have this funding that engage with the media, currently does not know how the strategies to engage with the media. When our commissioner said you have to pamper the politicians, it's the same way. Working with the media, there are specific strategies. For those 12 years I was head of that, I was very powerful in the media space in this country. Yes, that's the truth. I think I was the only individual that could pull media owners, media leaders, all the GMs from all over Nigeria within 2 days to one location, one phone call, and they will all come. I was that powerful. Do you know the reason why? Because I understood the language or as an organization, we understood the language of engaging the media leaders. Auntie Moji could do all what she did, and I can tell you I followed her since 1942. I can tell you that she did a lot of the things she did because of the passion within her. It was her. It was not NTA. It was her. And then luckily, because she was passionate about these issues, because she understood these issues, she was also a gatekeeper. So she now used that to push things. And she did her things well. She's well respected. So she could speak to authority and everybody. Are you getting? She made a statement that the media owners, media leaders are not interested in all these issues. And that is the truth of the matter. So how do you understand their language and pamper them in a way in which they will love these issues? There was a project recently, the Lafia project. I was a consultant, communications consultant for just 3 months. And I saw that in the entire plan of everything, which was focused on human capital development, which you talked about, linking health with human capital development, which is something very important for the politicians to sell health. The engagement for the media was just like an afterthought. How many CSOs or development organizations here today, when writing your proposal for funding or when approaching organization, have a plan to build the capacity of the media? The way you do a program to tackle political issues, to tackle politicians in a way in which they will be able to understand these issues, totally different. These are skill-based. It requires a lot of training. Big Mo is here. He's doing a lot of things because of the kind of training he has received. Madam Moji has gone for all kinds of trainings. There are strategies. Now, if as a CSO or government, you do not plan to engage professionals and set out budget to train these media people in the way in which they will be able to deliver these issues, and then put out a strategy also on engaging the gatekeepers, their organs. The media organizations are owned by politicians. They don't care. How do you engage them at that level that they will give these people you've trained the room
20 more seconds.
That is what I want to say.
All
so
right.
I want us to think about that in all our strategies, engaging them right. And then just tell us how you've been doing it so I can know how to advise later.
Thank you very much. Okay. Yes, please. We'll just take all the questions. Thank you.
The commissioner mentioned it in the beginning. We talk to ourselves almost all the time. The people who actually have the responsibility of fixing the problem are always not available. We were at the National Health Financing Summit a few months ago, and then I was also on a panel there, and immediately the minister finished his speech. All his entourage followed him and then went out of the room. And I challenged him. I'm like, this is what we say. And now that you have spoken and you are leaving, who do we speak to? And these are the guys who are going to make the decisions and change everything. Who here has the power to do anything? We are CSOs, we are experts, but when policies, except you that, in fact, people like you, I call you accidental discharge. How someone of your credit and competence gets to government most times is by mistake in such a country like ours, because we have a government leadership training deficit. People who goes to government know little or nothing about governance. They get to governance by the machinery of Nigerian type of politics. they have never led anything successful in their life, except campaign, which is mostly bought. So we are in a crisis. Okay, a simple litmus test, and I put it to all of you. A typical Nigerian politician does not know that development is more than physical infrastructure building. Efficient service delivery is a development asset. I mean efficient service delivery, that primary health care center works, not the building of the hospital. That the efficient, you go to the hospital and you see what you want there is a development asset. I am insured in, what do we call their insurance?
NHIA. Is it NHIA?
NHIS.
Okay.
God help Nigeria. I decided to go to the hospital, what they call it, teaching hospital, without telling anybody that I know there. I went before 7 o'clock in the morning so that I could quickly get the number. It was past 4 in the evening. Before someone who knew me in the hospital just came and saw me and said, what are you doing here? I already was begging that I'm okay. Just let me go. I don't want to see doctor again. But do you know what was sad? As at the time I eventually saw doctor, because of someone who saw me on the queue, he wrote 2 tests for me. I went to the first place of the test. They said what they will use to do the test is not available, that I should go and do it outside. I went to the second place I would do the second test. They said it was not available. Okay, he wrote 2 drugs. I went, this is a teaching hospital just last month. I went to the pharmacy for the 2 drugs. They say it's not available. From 7 o'clock till past 4, I just wasted my time. And they have made me go and do all those collect code, collect nonsense. And then I've collected everything. Maybe they will even pay those service provider for providing me nothing. So we have deficit of leadership training for people who go to our public space to serve. I just pray that people who will practically need to engage when governance issue comes to table, they will come to terms in this nation, that they will see us responsible and relevant enough to sit with us and have dialogue. Thank you so much.
Thank you, Mr. Emmanuel. Your experience is really the experience of a number of Nigerians, so I'm sure a lot of people could resonate, especially with that story. So over to this table, I have 3 amazing ladies that I just have to allow. Please, I am begging you, 1 minute each so that we have enough time.
I'll try. Good afternoon, everyone. My name is Dr. Ochi Akwiwu Ibe, TA Connect. A lot of people have mentioned things that I wanted to say, but I wanted to go back to the first question the commissioner asked, which is who is in the room when these conversations are happening. I hope that we have representation from political parties here. I have been in this space for more than 2 decades, like some people will say here. I worked on the policy project, and we brought together politicians, political parties to make sure that health was an agenda. And we're still, 20 years later, we're still talking about the same thing. It seems as if nothing has changed. So one thing I want to say to, beyond health being a political issue, is a human capital development issue. Nigeria is 164 out of 193 in the Committee of Nations. And why is that? Because of our health indices. Nigeria is not a quarter of the world's population. We contribute more than 25% to maternal mortality globally. It's a shame. And we shouldn't be there. So beyond, talking about health being a political issue, beyond economic issue, is a human capital development issue. And we are scoring abysmally poor in the Committee of Nations. The highest number of children who have never been immunized are in Nigeria. We shouldn't be there. We shouldn't be there. So beyond talking to ourselves as experts and the media, where are the political parties? Are they represented here? The people who are going to be able to draft this agenda, like he said, when they draft the agenda, they draft the manifesto, then when it comes to implementation, you have a different sector of people who don't even understand the language, drawing the agenda at the states. The last thing I want to say to Health Watch is, beyond monitoring, we're saying vote for health for Nigeria, we're looking at elections. The accountability has to continue even till the next election. So during the out of election cycle, we have to be accountable. We have to continue to monitor. Lastly, systems. My brother talked about systems, service delivery. The systems, are they there? Yes, they make the commitments, the government, the money is being released, but how are we looking at the systems? Frontline health workers, we don't have them. I agree with you. I worked in Liberia. The president understood the fact that an investment in a community health worker gives you $1 you invest in a community health worker gives you $15 back. And she drove the agenda, the president, because they knew that there was no way they were going to be able to battle Ebola without community engagement, without community involvement, without having community health workforce. I don't think we are still there in Nigeria. Thank you.
Thank you. And thank you for that charge. I see us actually reaching out and seeing how we can convene that conversation that will have this representation that you have really highlighted. It is important. I will not stop talking till something changes. So these conversations have to keep happening till something shifts. So thank you.
Okay,
Over to you,
Thank you
Dr.
very much. Thank you very much. I didn't want to say anything, but let me just say my mind. Health is one thing that if it's doing well, it shows. If it's not doing well, it shows. When you have over 2 million zero dose, it's not doing well. There's no need to deceive ourselves. It's not doing well, because if the primary health care centers are working, people will be going there to vaccinate their children. It is not doing well. I want to talk to my brother from Niger, and he said if they are doing well, we should announce it. Please, let me just say my own. No. And my own there is that it is not a matter of doing well. It's that you're doing your job. You're doing your job. That is why you are commissioner. We know that you can do the job, and you are doing the job. The problem now is that if you're not doing the job, is where the problem is. So we cannot celebrate you doing your job. We can only celebrate you doing something that is exceptional. You are supposed to do 1, 2, 3 in the primary health care center, and you did 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. That is when we will celebrate you. We will not celebrate you when the one we said you should do, it is not yet complete. And the zero dose is staring at us. Mortality rate is high. Dr. Gafar gave me some numbers today that this one is 80% doing well. And I'm wondering, is it Nigeria he's talking about? Is it Nigeria he's talking about? Because what I can see and what you can see is that it's not working. So the first thing is that we should please tell ourselves the truth. And in this room, we said so many things, and I'm grateful for that. But please, it's time to say strategy. What are the first 3 things we are going to do in this political dispensation? We have not talked about it. What are the first 3 things, first 4 things we are going to ask the politicians that we want them to do? We have not said it. It must be simple. The politicians are not doctors. They are not a public health specialist. They don't know all those things. What do we want them to do? That's what we should be discussing. And how all of us will start to amplify what we want them to do. Thank you very much, my people.
Thank you, Dr. Chika. And that's why you're here with us in the room, because really, you're going to help us with drafting those very strategic points. What do we want them to do? At the end of this meeting, I'm coming to meet you for those drafts. Thank you.
Thank you,
Dr. Biobele.
Yes, please. Thank you very much. So I'd like to speak to the commissioner. First of all, we were in your office last week to have a meeting with you, and I must commend you because I know you had conflicting. Yes, sir. With Motoni. I was part of the team that came from Budget Foundation to speak to you, and you had a conflicting engagement with the governor. But one thing I must commend was the caliber of persons we had that conversation with. It was an all-encompassing. The PAMSEC was there, the ES was there, the Planning and Budget Commission was there. Yes, you did, but I think they had briefed you. So for me, there's a lot of passion in the room when it comes to health itself, and for which I'm an advocate. But One thing I want us to also look at, which has also been said, and just reiterating, is looking at the bottom-to-top approach. Having that all-encompassing engagement, that we just don't sit down here and make those commitments and make those tracking itself, but we must make sure that those people at the last mile are felt, especially because we are coming from a place of privilege. We can access certain facilities because we have the opportunity to go to those facilities. But how about the person who has just that option and doesn't know anywhere else again? So for me, I'm looking at the last mile impact itself and ensuring that marginalized voices must be included itself. Because we are coming and saying, oh, we need this, we can do this, we can do this. But what about people who do not have that option again? I'm repeating the statement again itself. Young persons must be involved. We went to the town hall meeting at Pia Caro. And from the conversations we had then, one thing that stood out was when the health people spoke, people realized that it's not just what is my own interest in this, what is the collective interest for everybody. That's why we must come in. Because this political, we had a conversation with Nigerian Health Watch some days back, and people were saying, oh, you know, we're talking about accountability, we're talking about promises itself. Even a commitment is an accountability statement that we could hold you to itself for our political leaders, but we must be able to speak the language like everybody else has said. So thank you.
Thank you very much, Dr. Beer. I have 2 comments online. Oh, okay. I have to. So you have 1 minute, please. Just make it quick. Please accept my apologies. This conversation needs to happen, and I can see from the level of engagement that you all are also, you know, following and engaging. So please, just permit us to take as many as we can. But this is the last comment from here, and then we go online.
Okay. Thank you. Is this working? Okay, thank you. Good morning, everyone. My name is Fatima. I'm from the Nigeria Governors Forum. I really just want to, I have 3 things to talk about. The first is, I think I completely agree with the panelist about us not saying the good things that are happening enough. I'm not saying we should say things that are not correct, but as much as we have the problems, we also have some progress, and it is very important that we say that. I think the news that makes, I think they say it's bad news that makes news. So it's always Nigerian healthcare is poor, Nigerian this is that, but the little progress, like what Dr. Gafaro was mentioning, these are things I think that really, really need to go up there and need to be echoed so that we know it's not all doom and gloom and we're not just done for. I think this is very important. It would inspire hope. The second thing I want to talk about is about weaving a message in a way that a politician understands, and the Honorable Commissioner alluded to that. Simply just telling the governor that this is an investment, because again, whether we like it or not, whether we say it out loud or not, they are politicians at the end of the day, so they're looking for what would make sense to them in a political sense. And we don't have to say it in a way that would make it not correct. So there is a way that we keep the veracity of our information, but at the same time speak it in a way that makes sense to them politically. If you bring in, I remember I work on immunization a lot. Sometimes the difference between the release of counterpart fund for immunization and the non-release is actually how you weave the statement. If you go and tell a governor, release 90 million for immunization for so people in your state, his natural reaction would be, no, why are you asking me this much money? But if I say this is an initiative, this is something that is happening, a lot of partners are funding this, the total cost is 500 million, all we are being asked from you is just 10 million, then you realize that you're only contributing 2% from the total, then naturally they release it almost immediately. So it is really, really important. Sometimes it's not that they don't want to release the money, but it's the way we ask these things. So we have to know the audiences, we have to know who we are speaking to and speak in a language that they would understand. Lastly, regarding, I think someone mentioned how we would keep health commissioners in place for a long time. So this is actually one of the conversations that we have started having at the Governors Forum, just trying to see how we don't just keep changing commissioners anyhow. And if at all it needs to be changed, then there should be some sort of a mechanism that institutionalizes whatever it is that the commissioner is doing, such that whoever comes newly can just progress on that trajectory. But it's a conversation that is happening, and I think it's important that we all know that. Thank you.
Thank you, Fatima. Appreciate it. All right, Chris, please read the questions online quickly. Thank you.
All right. So we have, if health is truly a political priority, should every political health promise going into the 2027 elections be required to state exactly what will be delivered, how it will be financed, when it will be delivered, and how citizens can measure performance, and who should be held accountable when those promises are not fulfilled? This was from Mohammed Usman Diadia. The other question is to, I think, the Honorable Commissioner for Health, Niger State, has made significant commitments to strengthen primary health care, and the Basic Health Care Provision Fund is an important part of that financing. My question is, beyond internal government monitoring, what practical mechanism can an ordinary citizen in Bida, for example, use to know how much BHCPF funding their PHC has received, what it was spent on, and whether the expenditure actually improved services? Is the state considering publishing this information or formally engaging community structures in BHCPF utilization? Thank you. This is from Mohammed Mustafa Umar.
Thank you, Chris. So back to my panelists. It's been a long stretch, but I know that you're able to handle the task. So I'll start with you again, Dr. Gafar. You just respond to the specific comments that are around the media and the civil society, as well as what we need to really do in terms of drafting, like Dr. Chika has suggested, the key points from here. And then Dr. Bagana, you now round it up with your commitments and also specific responses to the questions that were targeted at you. I'm going to give you 3 minutes each, so let's keep it succinct and direct. Thank you.
Okay, thank you very much. A wonderful contribution from people in the room and online. So I want to start by charging us, those of us in the room and people online. The mindset shift has to start with us. Because when Chika spoke about, oh, I didn't see this, I didn't see that, I think Nigerians, we have to be truthful to ourselves in terms of how our mindset is causing more problem than solutions. I'll give you an example. A few years back, the Bureau of Statistics said Nigeria was in recession. I was saying, yes, Nigeria is in recession. Then later on, MBS say, okay, Nigeria is out of recession. People say they said Nigeria is out of recession. Honestly, this is very, very important. Development is about data. It's not about emotion. And when you are engaging with the stakeholders, and the stakeholders see that you've already made up your mind, because in life, you see what you seek. If you are looking for a problem, you see. But at the same time, development mindset is when you are able to look at the holistic picture and say what is working and what is not working. From what is working, how can we take advantage of it? From what is not working, how do we use what is working to address it? It's very, very critical, because I've interacted with so-called many CSO people. It's about fault finding. It doesn't take us anywhere. And again, with regards to the issue of pampering, I would not call it pampering of political class. I'll call it applying political economy sense. Being politically savvy. You can't solve a complex problem if you yourself are not politically savvy. I'll give you an example. When Governor Wike was in Rivers State as a governor, though it took me 2 years to lead my team to be able to see him, the day I met with him, he assembled his team, including the deputy governor, the present chair Senate Committee on Health, the commissioner for health, commissioner for chief of staff and everything. I started by telling Governor Wike things that have improved in Rivers State health sector. He sat properly and looked at me. I listed, and I was not telling like based on evidence, I told him everything. And I said, Your Excellency, these are now gaps that you need. It was a HIV financing related advocacy. I read out the statistics in terms of number of people with HIV, number of people that have access having care, people that don't have access to care. And he looked at me and said, thank you very much for telling me. I now that pointed to the Honorable Commissioner and said, Honorable Commissioner, how come I'm hearing all these things from an outsider for the first time? And it's the characteristic way of doing things. Governor Wike said, Commissioner, you are the one spreading HIV in the university. You are the one spreading HIV. And right there and then, he made some commitments, which were carried out immediately. So don't let us have this mindset of it's negative, and all those stuff like that. We have to be politically savvy. It's not about emotion. It's very, very important. That's number one thing. I hope I've not started using my first 2 minutes and all those stuff like that. Because we don't have this type of forum every now and then. Even people say when you have opportunity to climb an Iroko tree or whatever, you take as many as whatever you can, because you don't have opportunity to climb everything. Another thing we have to look at, that I have to be creative about, people are saying people in the room, people in the room. Of course, this conversation is designed for us first to articulate our thoughts. There are going to be several engagements with the governor, with the Minister of Finance and everything. But you yourself, you have not articulated your thought and you are calling people from outside. What do you want to tell them? So in terms of articulating, there are engagement, there are practical examples where we have effectively engaged governors, not only one in the past. And we have to think through what are we going to do to ensure that all the 36 state governors, we have engagement with them. We both within the country and outside the country, whatever works, we have to do it. There are instances I've taken governors to Chatham House in the UK because I know they will go and I know they will listen. I've been in a group work with Governor El-Rufai, Governor of Gombe, Governor of Nasarawa. We are doing group work just like if we are equal. And that was where we were able to pass the message across and seeing them subsequently become a lot easier. I'm not saying we should be going to UK every now and then. But we have to look at what works. It's very, very important to pass this message across. And we have to put ourselves in the shoes of the governor. Health is important, fine. But other things that are important for health that they are attending to as well. So we have to really look at how do we manage, how do we get the conversation going? How do we bring them on board and everything? The other thing I want to speak about is that from this, there will be other platforms. Nigerian USC Forum, in the next few weeks, we'll be organizing this kind of forum, learning from this thing that we have done and other sources, to have a roadmap of action in terms of what should happen before, during, and after the election. Nigerian Health Watch is part of Nigerian USC Forum. It's a coalition. Dr. Lake is part of it. Honorable Usman, who we have not duly acknowledged because of the great work he has done, is already part of it as well. So, don't let us be too skeptical and being focused on, oh, this is this problem. Let's be solutions focused. And it is actually doable. And at the same time, we have to acknowledge the progress we have made. And he's saying, identifying what are the gaps and now what we are going to do differently and leverage every opportunity that we have to do that. And at the same time, more importantly, I'm a student of political economy. We have to be politically savvy ourselves to solve the problem. Thank you very much.
Thank you, Dr. Gafar. Honorable Commissioner.
Okay, thank you very much. I think at some point I was just watching around the room. I could see a lot of anger, frustration, but very deep. They are all driven by passion. I think for that, I honestly consider this, my big sister, quite a successful engagement. And I think like a lot of speakers have mentioned, whatness, Dr. Chika. I know you particularly picked on me. Don't worry. When you jump politics, you understand. The truth about the matter is, after this conversation, do we have enough bandwidth with the media to engage politicians on purely health debates? If we do, can we start from this 2027? It is very important we do that. Second point I want to raise, and my brother, I want to address your point, and I think that is the gap. You have no business in University of Abuja Gwagwalada Specialist Hospital. You have no business there. In the healthcare architecture, you shouldn't even go to a specialist hospital. But it is not your making. The idea thing is, how many of our politicians understand the pyramid of healthcare, that the first point of call is at the primary healthcare level? Do you know what I did? And I understand what Dr. Lass was talking about. So there are funding for Impact Project to build a health facility. So what I did was, as a commissioner, because I will not always be there, and sometimes the people that will convince the governor, like my big sister mentioned, are people that are not even in the health space. I went straight to get the prototype, physical prototype of a PAC center. If you go to Government House, Niger State, on the table of my governor, when he comes to the office, the prototype is on his left-hand side. Your Excellency, you can de-invest or put resources if you get this kind of facility across, especially in the focal areas. So that is, for me, one of the most powerful communication. If you're a partner or you want to adopt a PAC, you come to Niger, the governor will tell you, if your money cannot get me this level 2 primary health care with fence, security posts, quarters, solarized, don't build a primary health care. You know why? Because he sees it every single day. That is a communication well packaged in an object. Those are the kind of language they understand. So if you have trust and our PACs are culturally sensitive, you will go to PAC. I don't think you did more than full block count and differential. A primary health care service center is quite in its right to do that. It is only referral. It's only in Nigeria that people will go to teaching hospital for common headache. Malaria. It is unacceptable. One, are the CSOs calling people out? You are stretching the facility. You are adding to the burden that ordinarily is stretching the facility. Because for you to go there, you're on the queue when you are not supposed to be on the queue. You are going to go to toilet when you are not supposed to go there in the first place to go to toilet. Somebody will clean that toilet. You are stretching the secondary and tertiary. That understanding, and I like what my sister mentioned, even the media needs to be trained. People need to understand that in the hierarchy of healthcare, there are levels. It is only when things are not properly done that you get referral, even to a teaching hospital. I just want to handle that. And that is why our general hospitals are not working, because everybody is boycotting the primary health care. Of course, because there are no drugs. The NHIS that you talked about, they can provide the service at the primary health care. Just to add to one of the points somebody mentioned, in Niger State, and I have to say it here, I asked for account statement of those officers in charge that utilize the money for the basic care provision fund. I will not wait for CSO, because no CSO has published it. You know why? Because they don't even have access to that. But if we begin to ask tough questions, if people are beginning to be given the authority to request, if you go to a facility like Dr. Lass mentioned, and you do a business plan and you are receiving 800,000 per quarter to do basic maintenance, hire ad hoc staff, you should have the right to request, if the health worker is not providing that, for you to have the enabling law to ask the bank to give you the statement of that utilization. Those are the kind of conversation that we should have in the room.
Yes, sir.
Somebody was talking about the right of health issues. Do you know that it is even in Niger State that the Child Right Act, that it is mandatory that parents, caregivers, guardians should vaccinate their child. If you don't do that, you go to prison for 6 months. It's there.
Yes, sir. So, rounding up now.
I might not be able to enforce it. You know why? Because I'm waiting for the next election. But you can do that.
Noted, sir.
Finally.
Thank you.
I want this room to live with a very powerful message that sometimes more is not better. Better is better. More beds, more facility, more money is actually not making service delivery better. It is only that little things, one step at a time. If you are doing it, do it well. When you finish your commissioner, pass it along. Somebody will take over from you. Thank you so much.
Thank you very much, Honorable Commissioner. And please clap for yourselves, my wonderful audience. You have been most patient with me, and I hope that you have enjoyed this session as much as I have. I'm sure if we add another 30 minutes, people will still have more things to say. But I think first thing I'm going to mention is that we have some very tangible next steps. The midterm review is something to really look forward to, and I want to urge all of us here, CSOs and the media, to make sure that we follow up and engage so that we can be part of that conversation, because that's how we build up to actually see the results that we're eager for. And our media, you have been charged to reawaken your passion, to really focus on those pain points that would make the difference in terms of how we engage our political leaders and the citizenry. So an important key next step that was also mentioned is, can we have a health debate with our policymakers and even the media? These are part of the forums that we can also advance this important conversation. The visual representation of the kind of outcomes that we want to see. So just, taking examples of the kind of language that would make the difference with our key policy makers. Let me also mention that Senator Banigo was actually part of the panelists that was supposed to be on this discussion. At the last minute, some pressing issues came up and she couldn't be here. So for you to understand that really we are mindful of who needs to be part of this conversation, but it's not one person's job. And that is why we have convened this kind of gathering, so that all of us can be championing the same message. We leverage the strengths that we have to keep pushing till there's a shift in the desired outcomes that we want to see. So again, Honorable Commissioner, we really sincerely thank you for making the time and for this very engaging conversation. Dr. Gafar, my boss, we're really grateful also for bringing this tangible perspective and for charging us to just, keep at it and to keep pushing. So thank you again. And again, a round of applause for my esteemed panelists. I'd like to invite us for a picture, and then we'll proceed to the next session. Thank you very much.
Thank you.
section of our Vote for Health campaign, would like to take just one more quick photo session with some of our targeted and invited guests. So please to the front. Our photographer is going to help with coordinating this. To our left, please.
Sorry.
All right, thank you, everyone. So we'll be moving into the next segment. Okay, so can we have some of our media representatives in the room, our journalists also? So can we have our journalists come to the front? I mean, one of the things that we have mentioned here today is intentionally recognizing the roles our media play in advancing health as a on our political agenda. So I think it's only fair that we recognize them for honoring this invitation. So if you could please all come out for a quick photo session. Thank you. So maybe not to worry, for the rest of us screaming involve me, there's still going to be a group photo at the end of this session with everybody. All right, so we're going to be having the next segment, which is the introduction of our Vote for Health campaign. And to walk us through this campaign, we'll be having none other than our Senior Communications Manager at Nigeria Health Watch, Ms. Asarindem. Please, a round of applause as she takes the podium. A round of applause, please, as she takes the podium. Thank you.
Hello, good afternoon, everyone. So during the panel session, Dr. Gafar mentioned that as states get more money, the desire to build more infrastructure increases, right? But how do we get that money to fund better reforms in the health sector? Good afternoon, and again, everyone. My name is Asari Ndem. I am the Senior Communications Manager here at Nigeria Health Watch, and I'm here to introduce the Vote for Health Nigeria campaign deployed by Nigeria Health Watch. Now, let me start with a simple question. When we go to the polls, how often does healthcare determine who gets our vote? We talk about the economy. Did you actually do what you said to Nigeria's election conversation? We want to hear directly from the people about health issues affecting their everyday lives and what they expect from their leaders. We will amplify those voices through Vox Pops, citizen stories, the radio, television.
On Mr. Chibike Alaboso, our Director of Media Programs, to take the closing remarks. If there's anyone having any issues with this, please just signify, and a member of my team will be coming around to help you out. Okay, so I know there's this thing we used to do in church. So if you are in, please say I'm in. Okay, so not all of us are in. If you're still out, say I'm still outside. Okay. There is food. So please, are most of us in? If you're in, could you just wave or signify thank you, thank you, thank you? Are there any people having challenges accessing this right now? Okay. On the back end, I'm told that we're receiving some feedback, but we've only gotten one. So please. Oh. Okay. This is also going to be a part of the post-event output we'll be sharing with you all here. We have gotten your contact information, so if you're unable to fill this out right now, it's still going to be a part of what you'll receive after this event, and so please, we would appreciate your feedback there. At this point in time, I'd like to call on our Director of Media Programs, Mr. Chibike Alakoso, to take us through the closing remark, and then we'll have a group photo outside, and lunch is served for you. So please give him a round of applause as he takes the podium. Thank you very much.
That clap is not very encouraging. Because you know I'm the one between you and lunch. Thank you, everyone. Good afternoon, ladies and gentlemen. Really excited and happy that we've come to the end of today. So I was wondering how to give this after a very really engaging and insightful past 3 hours that we've had. So, but I mean, we are a media and comms organization, so we tell stories, and I thought it would be good to circle back to where we started this morning, which was something Vivian said, that health is a political choice, right? So that's got me wondering, and also a major takeaway for me, right? And of course, we've all alluded to it since morning with the conversations that have been ongoing, which is who now makes that choice, right? So for me, that's one thing I will keep asking. And for me, it's also a choice that all of us have to continue making as experts. That also came out strongly, being able to contribute what we know, our skill sets when we are called upon to serve, either in our state or in other states, like Dr. Lash shared his experience coming from Ebonyi State, but supporting work in Abia State because of his work. But also it's a choice that we have to make as policymakers, very important, and also a choice that we have to make as media, like Atimoji called all of us, media colleagues. But importantly, it's a choice that we have to make as citizens, because we are all users of this healthcare, right? And we do this by engaging, by asking questions, because again, what trends is what we get acted on. Dr. Amina reminded us that. And you know, I'll just like to close on that and by saying, again, all the feedback that we received on the manifesto tracker, that we take collaboration not just as a word, but as an action word. So we are really looking forward to working with all of you to continue making it better, and at the end of the day, making health a political conversation during, before, and even after elections. So on that note, I want to say thank you, and do have a great rest of your day. Thanks.
Thank you very much. So group photographs are going to happen outside. Our photographer is going to help coordinate that, and then lunch is just right outside. You can pick that and leave. Again, as I said, would like to have a couple of you feature in our Vote for Health Nigeria campaign. So happy to have a couple of you record your sessions there. Thank you. So group photographs outside, everyone, please.